Hi, welcome to another episode with Mednich Dr. B. Our first topic is going to be based on dealing with seizures. So how to help someone having a seizure safely. Now please note this doesn't negate the place of an expert, as this is just a first aid response tutorial. Now, what is the importance of knowing how to respond to a seizure? For immediate safety, we want to make sure that we prevent injury and also maintaining airway to reduce the risk of choking and difficulty breathing. Now, we also want to reduce panic, especially in public settings. Also, you want to promote effective care, whereby you know when to call for emergency services and also providing reassurance post-seizure. Also, it's very important because we want to dispel myth and misinformation. Some people actually believe when a seizure is going on, the person will cut their tongue and swallow it. Now, we also want to empower communities by creating an awareness. So first of all, let's look at the word itself. Seizure. What is seizures? What does it entail basically? Seizure is a sudden, uncontrolled electrical disturbance in the brain. Now, that can cause changes in behavior, in movement, in feelings or consciousness. Now, seizures vary wildly in their effect and duration. We can classify them basically in two ways: basically generalized seizures or focal seizures, which can also be called partial seizures. But let's look at the generalized seizures. They affect both sides of the brain from the start and can cause a person to lose consciousness. Now, it has a whole lot of types, though the most commonly seen how there is the tonic-clonic. But we have the absence, the mild-tonic, the atonic, the tonic, and the clonic. Now, how long does it take itself? Generalized seizures last for 1 to 3 minutes. If it lasts longer than 5 minutes, it's a medical emergency. Now, focal seizures. Focal seizures, these are also known as partial seizures. They begin in a specific area on one side of the brain and can sometimes spread to other areas, but they don't always cause what? Loss of consciousness. It has different types. So we have the focal aware seizures and we have the focal impaired aware seizures. So basically simple partial and complex partial seizures. Now, there are a lot of types, causes of seizures basically. Let's look at the causes. We have epilepsy, head injuries, eye fevers, stroke, brain infections, and more and more and more and more. What are the common signs you see? Basically, you're walking on the road, you see someone seizing. What are the common signs do you look out for? The first one is sudden loss of consciousness, convulsions or uncontrolled jerky movements. Also, you look out for staring spells. You look at confusion. They are not aware of wherever they are at that point in time. We also look at unusual sensations such as tingling. Then it could be such a scenario of loss of muscle tone leading to a fall. Now, immediate actions to take. These are the proper steps to take when someone is having a seizure. Okay, so you keep calm and check the time the seizure actually started. Now the next step you're going to actually be doing is you guide the patient to the floor just to prevent the patient from falling due to loss of muscle tone. Then the next thing you do is keep all form of sharp objects or dangerous objects far away from the patient. Then you look for something soft and place underneath the patient's head. This is to prevent injury. The last step is to turn the person to the other side in order to keep the airway clear. And you keep calm until the seizures actually stop. Thank you. The seizure has ended. What do I do after? The first thing, stay with the person until they are fully conscious. Check for responsiveness. Keep the person calm and reassure them that they had a seizure and that they are safe. then make sure that they may be confused or disoriented and need a few minutes to recover. But all through this process, you need to know when to seek emergency help. The best thing to do is when a seizure is occurring, even before you start proceeding to do some things, you could just call someone around to do what? Call for emergency, whichever it is based on the country code you are presently in. But exactly what do you see in the patient to tell you, oh, I need to call for emergency help? If the seizures last more than 5 minutes, 1. 2, if the person has repeated seizures without regaining consciousness. 3, if they've never had a seizure before. This is the first one they haven't. In conclusion, in as much as you're trying to help anybody seizing around you, I would also advise that we respond calmly and effectively to a seizure. Also, I'd like to encourage you to please share the video to spread the awareness in order to help our community and the world at large. And subscribe for more clinical skills tutorials. Thanks for joining me today. Thank you for watching me today. Oh my god, the engine.